Broadcasting live from the Business RadioX studios in Atlanta, Georgia, it's time for Association Leadership Radio. Now, here's your host.
Lee Cantor here, another episode of Association Leadership Radio, and this is going to be a fun one. Today on the show, we have Louis Bernardi, and he is with BritePath. Welcome, Lou.
Thank you. How are you doing, Lee?
I am doing well. I'm excited to learn what you're up to. Tell us a little bit about BritePath. How are you serving folks?
So BritePath is an independent insurance agency here in New York. This is probably our 25th year in business, and we go by the name, the DBA of BritePath the past few years, because that's really kind of serves as both our call to action, our benefit strategies, and we wanted to put that out there front and center.
And then your role there at BritePath, I know you're a founder, but you also are called the Benefit Optimization Officer. Can you talk about that?
Yeah, so Benefit Optimization Officer, I coined that phrase within the past year. I was a general agent for about 25 years, which essentially means I was a broker's broker, helping other brokers serve their clients' employee benefit needs. And, I just really, I wanted to rebrand myself, and I wasn't happy with the terms that most people use, broker, consultant, advisor, because I really didn't feel that fit what I was trying to do, which was be more of a, something almost like an outsourced CFO. I want to be that outsourced BOO or BOO that works very closely with HR directors, CFOs, CEOs. I like to call them benefit decision makers, because there's some tricks to the trade and tools and knowledge that they simply really can't get on their own. I mean, you have to really dig deep. And so that's really kind of serves as a rebranding for myself, and it's taken off.
And it sounds like it's kind of almost a mindset shift in how you're viewing your organization, in terms of it's not the service isn't a transaction. This is a relationship-based service that we're partners and trying to really help each other symbiotically, get to a better place.
Yeah, it's even more than that. I tell people all the time, it's taken me 30 years to get 5 years of experience. About 5 years ago, I had almost by accident, came across the prices of healthcare versus the cost of healthcare. And I was pretty surprised. And I realized pretty quickly that, there's a lot of deception in healthcare and health insurance. The consumer is completely left in the dark, although there are some new laws that mandate transparency. Frankly, the healthcare systems, the hospital monopolies that exist in most cities like Atlanta and here in New York, they're not complying, and they benefit significantly by keeping the consumer in the dark. And we want to expose that. I'm part of several different organizations that are really committed to creating a more informed consumer, both of the employer and their members. When you purchase insurance from your employer, you're called a member, but when you go out and use it, you're a patient, and patients don't have any clarity either.
So is one of those organizations Health Rosetta?
It is. Health Rosetta, Aspirational Healthcare, Talent Champions Council, Free Market Medical Associations. These are all different organizations that are similar in nature. They are made up of benefit advisors or BOOs like me, as well as thousands of solution partners, TPAs, insurance payers, healthcare systems that are really committed to, helping to create a more informed consumer that can help to drive down prices instead of this perpetual pay more, get less than we're used to.
Now, as a business owner, you have a lot on your plate just from that. Why was it important for you to get involved in these kind of associations and organizations almost for the greater good of the whole ecosystem?
If it weren't for organizations and the collaboration that I get, the sharing of knowledge, the sharing of experiences, this would be going so much slower than it is. The honest truth is that there's a lot of people more advanced than me and my agency. They're throughout the country. And we get together virtually. We get together several times a year in person, and we share stories. We share successes, mostly what's working, which of the vendors actually can perform to their promise, right? At the end of the day, this is about making sure that the consumer is getting better access to healthcare, that they are able to identify where the best care is. We understand that we need to be extremely proactive about that. It's not about just giving people a website and saying, here, go here and look for yourself. The consumer needs assistance. It's been 25 to 30 years of grooming and dummying down a consumer where we just simply, even myself as a healthcare user, we act differently. We accept that there's no information. We don't do that in any other aspect of our lives. So these organizations help really speed up that the ability for us to help our clients and prospects achieve better results.
Now, you mentioned that in the last few years, there's been a noticeable shift. And can you talk about like the difference between today and 5-10 years ago?
Unfortunately, for a lot of people, it's not much different. But for those people who are aware that these conversations are happening, you're not going to get these from the status quo. There's so many misaligned incentives in health insurance and healthcare that the people that most trust to help them make these decisions, they're not digging deep. They're not finding alternative solutions because their compensation goes down. And that's a big part of what we do and what we're committed to in these different organizations is complete transparency, including compensation. But, there definitely are significant signs that change is happening throughout the country. I'm also a Forbes Business Council contributor. And when I talk to those people who follow the money, they can see behind the scenes at where investments, private equity money is going. And all of the signs show that there is a real huge shift happening behind the scenes in healthcare. And whether the consumer is ready for it or not, it's going to happen. I think more importantly, 5 years from now, the choices, the plans, the type of services and expectations of the consumer are going to be very, very different.
Now, there's a quote by Jeff Bezos that says, your margin is my business, or something along the lines of that. Is it happening because of technology and just the more and more transparency that if there's a lot of margin or there's a lot of what technology might deem as waste or ways that, and margin I think is the fairest word, that there's ways to squeeze some of that out with the advent of technology and sharing data and ultimately for the consumer, I would hope, get better outcomes in less time.
Technology is absolutely at the forefront of all of this. One of the, people argue all the time about the Affordable Care Act, but one of the real good things about the Affordable Care Act was the mandate and the release of information on all claims, both from private and public companies. So we can see using that data, and technology companies are the only ones that can take those billions of claims and make sense of them and help point people in the right direction. But what they really exposed, and because of the transparency legislation that's already started, it's not about margins. It is absolutely unfathomable what insurers and the healthcare system, and particularly on the pharmacy side, what they've gotten away with is hidden profits. I tell people all the time, I kind of explain it as if it's an English muffin. On the outside, it's nice and flat. It's got some cornmeal on it. It looks like one thing. When you cut it open, all of those nooks and crannies are where hidden profits, unreported income, for the healthcare system, for the insurance carriers, for the pharmacy benefit managers. Their way of doing business is really disgusting when you think about how the toll it's taken on businesses and their employees. And it's not stopping. The data now will become more publicly available. And I think that the health insurance and the healthcare system, there's signs that they're starting to turn on each other because they know someone's going to take the fall for what these prices will expose. And they're actually trying to become one another. Insurance carriers are getting into the healthcare business by acquiring different entities, and healthcare industry is getting into the insurance business. They know that these hidden profit centers are going to start drying up. And their goal, obviously, is not to lose that income. They need to replace it with other forms of income. And so they're kind of cannibalizing each other.
Now, I've heard some stories when they start kind of making it visible, some of the pricing, that like one procedure at a hospital could be hundreds of dollars, and then in the same state down the road, it could be tens of thousands of dollars. Or like you're saying with the pharmaceuticals, the cost could be pennies, and then the charge could be thousands of dollars. It's so disparate. Now, the people who are charging a lot, especially the pharmaceutical companies, saying, look, we have to charge a lot for the winners because we have so many drugs that don't work out. And part of the R&D, we're investing millions and millions of dollars. So we have to have some wins in order to incent us to keep playing the game. Well, like, what do you say to that? Well,
there's no question that it costs a tremendous amount of money to take a medication to market, and that there's many that they invest, billions of dollars probably into that never go to market. And we have to give them that, right? We want to advance medicine. There's no doubt about that. But the other ways that they are manipulating the prices, that they're manipulating the formulary drug lists to maximize profits, something called rebates, where pharmaceutical manufacturers will pay a rebate, we're talking in some cases, tens of thousands of dollars per month, that goes back to the pharmacy benefit manager, which are owned or are owned by insurance carriers. They're basically the middlemen. A pharmacy benefit manager is really the broker for medications. They're getting significant rebates. They're keeping part of it. They're passing, let's say 70% of that rebate back onto the insurance carrier. That's unreportable income. So common medications like Humira and Stelara, they're twice what they need to be. And there's no reason for that, right? If insurance companies and the healthcare system really were trying to do what their main page of their website is, work in the best interest of their patients and their members, that wouldn't be necessary. You can make a really good living being an insurance carrier or the healthcare system and still do it in an honest way, in a transparent way, and win business because you're working on the best interest of your members and patients.
Now, do you think that also some of these challenges we're having in healthcare are that there's a lot of regulation around things like, the amount of hospitals in a state that's very regulated. They tell you how many they can have and how many they should have, or the ability to get drugs over in other countries and then come here. I mean, there's a whole industry now of people traveling to other countries to get medical procedures done because it's so much less expensive in other countries.
Mm-hmm. Well, medical tourism definitely it's big business, especially for really large employers that self-insure and have a little bit more flexibility and say where they're, because they're paying the claim. And there's no question that things can cost more money here in the U.S. because of regulations. But there's I'll give you an example because we have access and some insights that most people don't. The whole healthcare system has evolved so significantly. It used to be independent doctors, independent hospitals, because they needed leverage over the health insurance companies who were kind of nickel and diming them with their fee-for-service rates. They needed leverage, so they merged initially horizontally. Hospitals merged with hospitals, and then they merged vertically. They had to take over other parts of healthcare, all the way down to the gatekeepers. And now they use those primary care doctors, those poor primary care doctors who are really suffering just as much as employers and members. And there's a significant shortage because there's such little money in primary care, and they are such an essential part of healthcare that's missing today. But they use them to drive people to where they can maximize their profits. So at a hospital, something like an MRI that costs about $200, their self-reported cost, they will charge $5,000, $6,000, $7,000 for. And only because that number is completely artificial. Your typical insurance carrier gets, let's just assume, a 50% discount, and they want $3,000. So you have to charge $6,000 to get $3,000 for a $200 procedure. And as you mentioned before, right next door, there might be an independent facility that would perform that same MRI for $600, $700, $800. And if you're paying cash, it could be as low as $300 or $400. The truth is, the cash price can be significantly less if you call in advance and say, hey, I don't want to use my insurance, or I don't have insurance. But if you just show up and you go to that hospital where you're typically going to be driven or steered towards, they're not going to feel bad sending you a bill for $7,000 whether you have insurance or not. And that's just wrong. The consumer needs to know, especially for things like radiology, where they can get the most bang for their buck. You know, the health insurance plans that so many people are walking around with today are not the $5 or $10 copay variety that they had 20 years ago. You have families walking around with $14,000 deductibles that are still paying a pretty significant amount out of payroll to have the privilege of having the responsibility of paying the first $14,000 of their family's healthcare expenses. That's just not acceptable to me and so many other advisors in the country. And we really want to make a stand and do something about that.
So what can people do to help?
People, employers, patients, they have to demand more. They have to challenge those that they trust to help them make these decisions. The focus has to be taken off of insurance. The problem is that the consumer has been groomed to think there's nothing they can do about it, that the claims are the claims, and that what they're doing is they're buying insurance. You're not buying insurance. You're buying access to healthcare for your employees. That's the investment you're making. And when you stop thinking about the insurance and you start thinking, am I getting the right healthcare? And you have that conversation with your trusted advisors, you're going to find out really quickly if that person even knows what you're talking about. You know, when you go shopping for a house, you're not buying a mortgage. You're using a mortgage to finance the purchase of that house. When you're buying health care for your employees, you're financing it with the insurance. And that's the way the mindset of the employer has to change to. And if you're a patient, you have to ask first. You have to be your advocate. And you have to understand that the healthcare system is built right now under the managed care fee-for-service model to maximize profits. That's not to say doctors are bad people, but they're great people. They only get about 26 cents of every dollar of what's spent on healthcare. And that's just not acceptable.
Yeah, we've created so much complexity in the system and unintended consequences of actions over the years. It's just a really difficult challenge to navigate today with almost having to blow it all up and start again from scratch.
Yeah, the truth is that if you have the proper plan design that's built with incentives, this is not something every employer can do, depending on your state. You can't self-insure, but you don't have to self-insure to still think of yourself as a consumer and use technology and apps and build a plan that rewards people for making the right decisions. There's tons of companies, and we work with several of them, where your typical high deductible health plan that an employer might fund with an HRA type of mechanism, right? Because they want to pay less insurance and they're willing to make a bet that their employees' healthcare costs that they would have to fund is less than that, premium savings. So there'll be a net plus. You can wrap something around that and give your employees a tool and incentivize them in a positive way to use that resource that is going to point them not to where the care is the cheapest, to where the quality is the best. And the hidden secret within healthcare is that the best care costs less. It really does. You just have to be willing to have that conversation and start thinking about yourself as a consumer and challenge the whole system. That's what will change. When the consumer takes their business elsewhere, those people that hold the reins have no choice but to change with it. And that's imperative.
So how, if you look into your crystal ball, how far away are we from having a healthcare system that works more efficiently and effectively?
I mean, it's already happening, but just not quite for quite enough people as possible. I believe that the managed care networks and the carriers that you know today, we call them the BUCAs, the large 5 insurance companies. They will be operating very differently within the next 5 years. I think that it's possible that networks will disappear again, and that insurance carriers will go back to being the payers of healthcare, the processors and the administrators, just like what a TPA is to a self-insured employer, because the value that insurance carriers are providing today just isn't there, and they'll be challenged by the consumer who's going to want to see that transparency, and their pyramids of wealth that they've built are going to start crumbling on them.
Well, it'll be thanks to folks like you who are kind of looking out for the greater good and being part of organizations and associations that kind of have their eye on a true north that's helpful to more and more people.
Absolutely. Thank you.
And if somebody wants to learn more about BritePath, what's the website?
Website is www.britepath. That's BritePath.com.
All right, Lou. Thank you so much for sharing your story. You're doing important work, and we appreciate you.
Thank you. Have a great day.
All right, this is Lee Cantor. We'll be back next week with another episode of Association Leadership Radio.